In the past few weeks, I mean, it really has, and I hope we get to the bottom of it, this phenomenon of, I think it's fair to call it a spate of food-related illnesses, 6 deaths, tragically, around schools, and it does appear that the guilty thing might be snacks that are bought from vendors, spaza shops, roadside vendors. And there's been a lot of behind-the-scenes work, police, municipality, the environmental director of the National Department of Health, the Department of Agriculture, the National Consumer Commission. I spoke to their head of complaints and investigations last week. Nat Joints has been involved, the National Institute for Communicable Diseases. So there has been a very, very widespread, and it seems quite deep, attempt to understand what is at the root of this. We're joined now by the Health Minister, Dr. Aaron Motsoaledi. Minister, good afternoon.
Good afternoon, John. Good afternoon to the listeners.
There seems to have been consensus that the problem is chemically caused rather than biologically or via a physical agent. Can you talk us through how that conclusion, which is now leading to 80 inspectors going out and searching for this chemical agent, how that conclusion was reached?
Well, as you said, John, Nat Joint regarded this whole matter as a threat to the security of the country and its citizens. So Nat Joint, being the coordinating body of all the security apparatus of the country, reached a conclusion that because there's been so much work, as we have mentioned, by various state institutions, they must come together and be coordinated. And the Department of Health takes over the coordination because whatever is it that we are dealing with in the final analysis, it leads to illness and death in some instances, as it has happened in Naledi. So health took over, and we called all these institutions that were investigating, including the National Institute of Communicable Disease, which was not involved, but we called them because of the experience and the skill they showed when they were tracing the source of listeriosis. If you remember, John, some years back, when people were dying from eating polony, we didn't know where the source is, where it was emerging, and they were able to trace it. So we called them. So each of these structures reported what they've done, what is their experience, what are their findings. And that's when we reached the conclusion that we're dealing with a chemical agent, because we also looked very carefully at the symptoms that were being mentioned, the symptoms that some of these kids displayed. We realized that here it's not a biological agent, which commonly is the one that causes what people usually call food poisoning. And we said, no, this is a chemical, we must go and search for it.
Is there any idea what chemical it might be and how it has become part of the lives of so many unfortunate school children recently?
That's exactly what the teams are out to find out. We don't want to speculate. I must confess to you, we have got a fairer idea what we are looking at, but it will be very untimely to mention it because, you know, in medicine, John, you work with what you call differential diagnosis. Even if clinically is pointing to something, you don't put your foot your leg on the block and say it is this, because it might actually not be. So you must still investigate and have laboratory confirmation before you can go out and start talking about something.
So it's for understandable reasons. There's been a lot of tension in the areas where these things have been happening. Naledi, particularly, with those 6 tragic deaths of young people. And you will agree, I know, that the sooner that there is a full understanding of what has happened, so that responsibility can be appropriately apportioned, it's better for everybody. It's better to get that chemical agent, whatever it is, out of whatever system it is in, how it is being delivered into children's mouths. So that there is, I'm sure you will agree, some urgency here. Yeah,
no, indeed. But it will be grossly responsible for us to move because of pressure. There is a lot of public pressure on us, we concede, but it will be responsible to point to something without we even have laboratory confirmation of anything, because imagine if we happen to be wrong, somebody will have somebody will have been, have their reputation irreversibly damaged, and we don't want to do something like that. When we come out and say this is it, and this is how it occurred, we must be dead sure that we know what we're talking about.
I sincerely hope that one of the possibilities is not that this is being deliberately done, that this is being done rather by accident, through oversight, through carelessness, through laxity.
Yeah, because it beats us if it's deliberately done. If it could be deliberately done and affecting school kids, or what battle should somebody who's an adult have with school kids to an extent where he poisons them? And the poison is happening randomly, remember. So it will be a very sad day. And if it was happening in one area, maybe. Remember, this is widespread. It's quite a while. It's worse in Gauteng, but it's all over the country now. So we think, look, it's far-fetched to say somebody is doing this criminally. We'll be very much interested to see. But fortunately, in the team, we also have detectives who have been investigating this matter, and they'll be able to tell us whether it was deliberate or not.
Dr. Aaron Motsoaledi, I understand that you came out of a meeting to talk to us. Thank you for doing so. Dr. Aaron Motsoaledi is the Minister of Health. Help. Help us to health. That's what he's the Minister of, helping us to health.